10 Celebrity Plastic Surgery Disasters. The allure of Hollywood often comes with the pressure to meet certain beauty standards, and many celebrities turn to plastic surgery in pursuit of perfection. However, not every journey under the surgeon's knife results in the anticipated enhancement. In this realm of fame and fortune, some well-known personalities have faced the unfortunate consequences of disastrous plastic surgery. From once iconic features transformed into unrecognizable forms to the unintended impact on careers and legacies. These celebrity plastic surgery disasters serve as cautionary tales, prompting reflection on the fine line between self-improvement and the risks that accompany the pursuit of aesthetic ideals. Number 10. Michael Jackson. Michael Jackson began his career as a young singer in the band Jackson 5, sporting a black afro and dark skin. However, a significant aspect of his transformation was the change in his skin color. He attributed this transformation to the skin condition vitiligo, an autoimmune condition where the body attacks the skin's pigment, resulting in patches of missing pigment. Autopsy reports confirmed his vitiligo diagnosis. But unlike typical cases where individuals with vitiligo have patches of lighter skin, Michael's entire skin became noticeably lighter. While vitiligo could explain some of the skin changes, there are suggestions that he might have used additional measures to lighten his skin. Skin lightening treatments, such as creams like hydroquinone or IV treatments like glutathione, are possibilities. Throughout his career, Michael underwent numerous facial surgeries, including facelifts, nose jobs, chin implants, and lip tattooing to achieve a desired appearance. His multiple nose jobs, a topic of curiosity, raised questions about the naturalness of his features. While it's not uncommon for individuals to undergo revisions after a nose job, Michael's extensive surgeries, possibly 3 or more, led to the accumulation of scar tissue over time, resulting in a distinctive, and to some, unnatural appearance. Number 9. Jocelyn Wildenstein. Jocelyn Wildenstein, also known as the Catwoman, is a socialite who has undergone numerous cosmetic procedures over the years. Her transformation has been quite dramatic, leading to a highly altered and unnatural appearance. Wildenstein's surgeries reportedly include facelifts, brow lifts, eyelid surgeries, cheek implants, lip augmentations, and more. The aim was to achieve a feline-like appearance, hence the nickname Catwoman. However, the results have been met with mixed reactions and have sparked discussions about the potential risks and consequences of excessive plastic surgery. It is possible that Jocelyn Alice Wildenstein is in her 80s, although she does not appear to be in her 80s. Because of the possibility that she has undergone multiple cosmetic procedures, the Swiss socialite is famous for her appearance, which resembles that of a cat. Some web publications have speculated that she may have undergone surgery more than once. Both Catwoman and the Lion Queen have been used to refer to her by various media outlets. On the other hand, she did admit that she had a multi-million-dollar surgery to make her eyes look more cat-like. And of course, judges don't just say random things like you can't use your alimony payments for further cosmetic surgery out of the blue. Jocelyn's statement that she does not have excessive plastic surgery and that she looks like she does because of her Swiss heritage was shocking. Number 8. Meg Ryan. Meg Ryan, celebrated for her sweet and innocent image, has undergone a noticeable transformation in recent years that diverges significantly from her iconic look. The actress, renowned for her roles in romantic comedies and series during the 80s and 90s, exuded a bubbly personality that resonated with audiences, showcasing both her external and internal beauty. In contrast to her earlier career, Meg Ryan has shifted away from the spotlight of female heroine roles in recent times. Opting for what some describe as the classic Real Housewife appearance, she has departed from the natural grace that defined her prime. This transformation has ignited debates among fans and the public with speculation about potential cosmetic procedures. One of the most noticeable changes in Meg Ryan's appearance is attributed to cheek fillers or a fat transfer to enhance her cheeks. The result is a pronounced fullness in the apples of her cheeks, which some find excessive. When she smiles, the movement of the filler gives the impression of smaller eyes, contributing to a more masculine appearance due to the volume placement in her cheeks. Number 7. Donatella Versus. Donatella Versus, the renowned Italian fashion designer, has been transparent about her experiences with plastic surgery, and the outcomes have generated considerable public discussion. The array of procedures she has undergone, which includes facelifts, lip augmentations, and Botox injections, has led to a significantly altered appearance that has not escaped public scrutiny. Over the years, Donatella Versus's plastic surgery journey has been a subject of widespread discourse, marked by observable transformations. Multiple reports indicate her participation in various cosmetic procedures, ranging from facelifts and Botox injections to implants and laser resurfacing. These interventions have collectively contributed to a notable change in her facial features. The use of silicone in her cheeks, among other aspects, has specifically sparked concerns and criticisms from some plastic surgeons, raising questions about the overall aesthetic outcomes. While there are assertions about corrective surgeries, the debates persist regarding the overall impact of the interventions on Donatella Versus's face. Number 6. Lara Flynn Boyle. Lara Flynn Boyle initially gained recognition for her old-style Hollywood grace in movies and television, particularly through her iconic role in The Practice, 1997 to 2004, which propelled her to stardom. Her rise to fame included roles in critically acclaimed films, earning her widespread love and support from the public. However, in recent years, Boyle has become the center of attention, not for her acting prowess, but for the dramatic changes in her facial appearance. Speculations have circulated that these changes may be the result of multiple plastic surgeries, leading to a transformation that has left her nearly unrecognizable. Embracing what some describe as the classic Real Housewife look, Boyle's altered appearance has become a focal point of discussion. While some attribute the change to unflattering photos circulating online, it is evident that Boyle's recent transformations highlight the potential pitfalls of excessive plastic surgery, diminishing her natural beauty. Observers and critics alike suggest that she may have undergone procedures such as rhinoplasty, lip augmentation, dermal fillers, Botox, and possibly a facelift and brow lift. Despite the initial transformations, opinions converge on the notion that Boyle's subsequent procedures, particularly the addition of more fillers, have resulted in an overfilled face that is unfortunately not seen as flattering. Number 5. Hang Myoku. Hang Myoku gained global attention as the poster child for plastic surgery gone awry in 2008. Originally an aspiring model and singer in South Korea, her life took a tumultuous turn due to a 20-year-long addiction to cosmetic procedures. Despite initially having conventionally attractive features, Myoku delved into plastic surgery at the age of 28, seeking to achieve what she perceived as smoother and softer skin. Her obsession led her to undergo numerous procedures, prompting doctors to eventually refuse further interventions. Concerns about her mental health surfaced, leading to referrals to psychiatrists by her parents. While initially undergoing mental health treatment, Myoku's financial constraints compelled her to return to plastic surgery. In a distressing turn of events, she resorted to injecting silicone into her face at home after being supplied by a doctor in Korea. When the silicone ran out, desperation drove her to inject cooking oil, resulting in severe swelling and scarring. This drastic action left her head and face disproportionately large, earning her nicknames like the Fan Lady and Standing Fan from local children. Myoku's story gained widespread attention after she appeared on television, expressing regret for her actions and seeking a return to her previous life. In response, viewers generously contributed funds for corrective surgeries. Over 10 procedures were performed to remove 260 grams of silicone and oil from her face and neck, significantly reducing the size of her face. Unfortunately, despite these efforts, her original appearance could not be fully restored, serving as a cautionary tale about the dangers of unchecked plastic surgery obsessions. Number 4. Courteney Cox. The actress, known for her previous career as a model, once graced magazine covers with her beauty and captivating presence. Fans enthusiastically welcomed her transition to film with Scream in 1996 and her return to television in Cougar Town from 2009 to 2015. However, the focus on her plastic surgery, fillers, and Botox has shifted attention away from her naturally striking blue eyes and inherent grace. The actress now exudes a more socialite vibe, and her leading role in Cougar Town has become something of a facade in recent years. Speculations about a possible mini facelift, a procedure known for delivering more subtle and natural results compared to the dramatic facelifts of the past, have circulated. Courteney Cox's use of fillers, particularly on her lips and cheeks, appears to some as being overly done. In a candid interview, Cox admitted to actively pursuing a more youthful appearance through facial procedures, a decision she later came to regret. Consequently, she took the step to dissolve all her fillers, aiming to embrace her natural look. Unfortunately, the traces of her numerous plastic surgeries remain visible on her face, serving as a reminder of her journey with cosmetic procedures and the challenges of finding a balance between maintaining youthfulness and preserving one's natural features. Number 3. Donatella Versus. The esteemed fashion designer, Donatella Versus, has left an indelible mark on the fashion industry, contributing iconic works and striving to elevate Versus into a household name synonymous with high-end sophistication. Despite her significant achievements, her journey through multiple cosmetic procedures has attracted attention, revealing the challenges even the rich and famous face when it comes to maintaining a natural appearance. Donatella's regular engagement in cosmetic procedures has rendered her almost unrecognizable. Terrible lip surgery and excessive use of Botox have been apparent in her evolving looks. The shininess of her skin, often indicative of an abundance of Botox, led her to undergo laser skin resurfacing, which, unfortunately, did not yield favorable results. Notably, prominent lines between her mouth and nose suggest an excess of filler in her cheeks, contributing to an unnatural look. Her lips, overfilled through numerous injections, lack proportionality to her face, with the top lip losing definition. The absence of adequate time between treatments and a conservative approach in her cosmetic journey are also speculated. Comparing recent images to those from 1993 highlights the vast difference in Donatella's appearance, even considering the natural aging process. Some critics argue that her recent look is a departure from her original, more natural features. Journalists have even likened Donatella's approach to plastic surgery to acquiring new shoes or handbags, suggesting a casual and frequent engagement with cosmetic enhancements. Number 2. Mickey Rourke. The American actor initially gained recognition with his debut in Botched, 1981, and went on to showcase his acting prowess in subsequent films, drawing comparisons to iconic figures like James Dean and Robert De Niro. His comeback in the 2000s with notable roles in Sin City, 2005, and The Wrestler, 2008, solidified his status in Hollywood, previously known as one of the industry's most handsome stars. However, a shift occurred in his public image due to plastic surgery, altering his trajectory. Once celebrated for his bad boy persona in 80s cinema, a botched plastic surgery, including cheek and chin implants, led to the transformation of his original tough guy image. The change in his appearance became particularly evident after the surgery, affecting his standing in the eyes of the audience. In 2009, the actor openly acknowledged that his altered looks were a result of botched plastic surgery, attributing most of the procedures to mend injuries sustained during his boxing career. Unfortunately, the choice of the wrong practitioner led to a drastically changed appearance. Subsequently, Rourke underwent numerous Botox treatments and adopted a distinctive style that further distanced him from his glorified bad boy days, marking a departure from the promising young actor of the 1990s. The actor's journey reflects the impact of plastic surgery on his career and public perception. Number 1. Amanda Lepore. Lepore proudly showcases her extensive plastic and reconstructive surgeries, referring to them as her life's work. At 55, she has embraced a journey that began as a boy in Cedar Grove, New Jersey, transitioning at the age of 15. Lepore's path towards her current self has been marked by a series of transformative procedures, creating what she describes as a silicone-paved road. From her early fascination with Marilyn Monroe, Lepore has evolved into a celebrated figure in Manhattan, earning a living through various avenues such as burlesque performances, modeling, singing, and hosting. Her transition story includes multiple breast augmentations, butt implants, and rib surgery aimed at achieving a smaller waist. Despite the multitude of alterations, Lepore remains transparent about her transformative process, rather than conforming to societal expectations or resembling those who once bullied her. Lepore has actively shaped her appearance to reflect that of a movie star, taking control of her aesthetic goals. Her look serves as a testament to the obvious and extensive nature of her plastic surgeries, leading to her being labeled the most expensive body in the world. Virtually every part of her body that can be altered has undergone surgery, illustrating the depth of her commitment to her unique and meticulously crafted identity. Conclusion: celebrities serve as stark reminders that fame and wealth, while offering opportunities, cannot shield individuals from the potential pitfalls of disastrous plastic surgery. While the intention behind facial and body enhancements is often rooted in achieving personal comfort and aesthetic satisfaction, instances where these procedures go awry can have lasting consequences on careers and legacies. The experiences of certain celebrities highlight the delicate balance between the pursuit of self-expression and the risks associated with cosmetic procedures. The repercussions of botched surgeries serve as cautionary tales, underscoring the importance of careful consideration and informed decision-making in the realm of plastic surgery.